Okay, so Courtney, as we saw before, she could benefit from Pigeon protocol, okay? So what we're going to do is we're going to do a few tests just to set some feedback loops, all right? So let me get you to grab a seat here, and let's do your pigeon foot test and just see what it is 1 to 10. You just tell me what the score is. Okay, so foot up and in. There you go. Don't let me rotate you out. Resist and go. Okay, so what's that 1 to 10?
6.
Okay, so we got a 6 on the right. Let's do the same thing on the other side. And go. And that one there. Okay, yeah, agree. They're about 6s. Okay? So she's about a 6 out of 10 on both. We also established previously that she also has flat arches and her ankles collapse in an inward way. All right, any other challenges anywhere else in the body? Hips or shoulder? Okay, so stand up. Tell everyone what's going on with your shoulder.
If I do any like pressing motion, like push-ups, bench press, overhead press, I get like a really, really bad pain in my wrist for like up to 2 weeks following.
Okay. So when her shoulder's moving around, for some reason that's leading to a lot of wrist pain. We don't know what's going on and what's behind that. I did a couple quick assessments with her. I'm just going to show you guys some stuff that's from level 2 and from our shoulder online course. It's not normally a part of level 1, okay? But let's do this. I'm going to test out your shoulder. Yeah, if you don't mind. So I'm going to test out her shoulder and we'll just see what happens, okay? Okay, so I want you to score this 1 to 10. Resist and go. Okay, what was that 1 to 10?
Like a 4.
And was it painful?
Yeah.
What was the pain 1 to 10?
3 or 4.
Okay, so we're going to say this. Shoulder, okay, pigeon test is 6. Shoulder, 4 out of 10. Pain, 3.5. Okay, how long has the shoulder been a problem?
It'll be 2 years in January.
Whew, 2 years. If we could do anything to benefit your shoulder, would you be happy?
Yes.
Okay. All right, because we're gonna try all of us right here. We're gonna put all our heads together. We're here for you.
Okay.
We're gonna try to make an improvement in shoulder pain and function.
Okay.
All right, so I'm gonna show you guys something. Hold your arm out in front. I'm gonna put my fist right here. Okay. Now I'm gonna test out your shoulder. Resist and go. How'd that feel?
Fine.
Any pain?
No.
Did you guys see what happened? Nope. Yeah, it was serratus anterior. She has a downward rotated scapula, so if you take a look at that, that's a negative angle. The bottom is closer than the top. It should look like that.
Can't see. Sorry.
Yeah. So that's what she looks like.
Okay.
It should look like that.
Oh, okay.
All right? So I just did a quick look, and I'm like, that shouldn't look like that. So what it does is it pinches the acromion down over top of supraspinatus, which leads to problems in the apprehension sign. It also compresses some of the nerve bundles, and those nerve bundles can lead to numbness and issues in the hand. So if I get her to do this, you said, what was the opening and closing of the hand issue you described?
So after I do like the same like pushing motions and stuff, I have a really hard time like for like 2 weeks following. Like I can't squeeze anything really hard or like it hurts to open.
Yeah. So I'm going to give her the actual test for this. So this is a level 2 test, but since you guys are awesome, I'm going to teach you some stuff that's not normally taught in level 1. So I should never be able to unfurl somebody's fingers. Okay? I want you to resist as hard as you can. Okay? So I can get my hand out of there and unfurl the fingers, right? What was that 1 to 10? 10 means I can't budge you.
3 or 4.
Okay, so it's a 3 or 4 on finger flexion. Now, I'm going to get you to reach across to that same spot and press hard. It's her serratus anterior that I'm tensing, by the way. Same spot. Now, and I can feel it right away. Can you not feel it? Like, you're actually going to leave marks in there. You're digging in so hard. All right, resist as hard as you can. Go. Okay, I can't even budge it now. And I have like little nail marks in because of how much stronger her grip is. Okay, so I'm hitting one spot, boom, right here on the side of the upper ribs. Makes the shoulder pain-free and strong. You can get her to actually grip. Everything's connected.
So is your it's overactive for stratus?
No,
No, underactive.
Underactive.
Ankle.
Yeah. when the serratus anterior activates, it does that. So I'm trying to get her activating the serratus anterior, right? Now, anyway, we're going to try to just do everything all at once here, I guess. Might as well. Look at that indentation. Can you just verify I have a serious indentation on my finger right there? Yeah, this is a danger pay. But she was like, I just want this so bad. Okay, but I can do it with wrist flexion. Like, you go like this. Don't let me straighten your wrist. Okay? See how easy that is? Do the same thing. Press on that spot. Or right here. You're in the general area. Yep. Resist. Go. Okay, it's not a 10, but it's still much better, right? You see all of those, that's making all of those things better. So, let's do this, but then another thing is this. Roll your ankles out. I'm giving her a fake arch.
Like normal out or extra out?
Extra out, extra out, yeah. Giving her a fake arch. Do your shoulder test again. Because giving an arch can often help shoulder stability as well. See the difference in strength? Now, let your arches go flat. Okay? Yeah, see the difference? So everything's connected. If she's collapsing through the arches, everything's collapsing going all the way up. All right? So I believe if I get you to just give yourself an arch and all of a sudden your shoulder doesn't hurt, I believe it's connected in a way that's significant. And a lot of times we come from an allopathic system, which means that you are trained and socially programmed to believe that the site of pain is the cause of pain. So when somebody presents with a shoulder problem, you're going to the shoulder, right? But as we're seeing here through real life experience, unless she's a paid actress or she's a good liar, like these things are changing her shoulder pain instantly, right? Which is significant to know. All right, are you ready to try to make things better?
Yes.
Okay, so we're going to go through Pigeon protocol, and here's what we're going to do is finger flexion. Your finger flexion was a 3.5 out of 10, was it? This one here? What was that?
Yeah.
3.5, okay. I'm going to use feedback loops here. I'm going to use the pigeon foot test, which was 6s out of 10. Okay, I'm going to use the shoulder test, which was a 4 out of 10 with a 3.5 out of 10 level of pain. And then I'm going to use her finger flexion. Normally I don't use that one, but because it's real to her, I'm trying to see if we can help her with that. So that was a 3.5 out of 10. We're going to see if we can get her fingers strong. Okay, so let's go through the sheet together. Okay, and we're just going to lacrosse ball out the bottom of the foot. Cool to do that? Where's the lacrosse ball? Oh, yeah, here we go. All right.
Okay.
Yeah, I'm going to get you to do it actually standing, holding onto the wall, because then you'll put more pressure on it, okay? Does anyone have any questions about this so far? It's actually a really interesting case study for you, and normally I don't do something this kind of far out there on a level 1 case study. But if you experience it live at a course like this, my hope is that when it happens in your life and you need it, you'll be able to come back to this moment and remember what you're capable of doing. Because right now you can notice how sloppy and unprofessional I am as I walk through all this stuff, right? Like you could probably do it. You guys, yeah, sure. See, look, I'm not even keeping count of this stuff. Yeah, I just want to show you guys you can do a better job of walking somebody through this than me. I'm not timing anything, I'm not counting anything, but we're still going to see if we can make a difference here. Okay? And then the next one I'll be getting you to do, and I'll show you this, is side to side cross friction massage in here. So you just go like this and you rub side to side like that.
Like all the way down?
Yeah. And you're just kind of swimming it in between. I'll just show you here quickly. You swim it in between like this. This isn't too bad. Normally I get it a lot worse than that. So it's just a little cross friction massage, working her way up and down, okay? So she's just loosening that up, which can help out if there's any, if there's any scar tissue or damage in there, tibialis posterior. That's what we're just trying to free up, okay? So that's side to side, lower leg massage, okay? Then the next one we're going to do is the fascial wipes. Up the inside, down the outside, hands off, repeat. Good, really firm. I want you to do that. And I want you to give me 20 reps, okay? And her form is excellent. I think she's motivated. You're ready to get rid of some of this stuff, aren't you? Okay, keep going. Keep going. So, and then next we'll be doing the belly breathing on the ball. All right? And also, yeah, both sides. The other thing I would do too, you guys will notice, I have considerations on the back here, so I have a whole bunch of things I'd be telling her, like we need to be careful with heavy lifting, like in the 1 to 6 rep range. We don't want to be collapsing for squats and deadlifts. We don't want to be collapsing the arches more. When she's doing exercises, I'm going to want a narrow stance for everything. So feet together, because that helps to activate the arches. So I'm going to get you just to lay face down, belly button over the apex, and do this one. You're just going to do 10 belly breaths, okay? So she's laying face down, and I'm gonna back you up a little bit. Right there is perfect. So just kind of breathe through this area here. Keep the head relaxed. You'll feel some tension. This is a good tension, okay? And just take 10 big belly breaths there, okay? So she's just opening up, because sometimes a bit of low back compression can happen with flat arches, because we just hit the ground a little harder without those arches being as elevated, okay? So I always tend to decompress a little bit here. So the other thing is single-legged exercises, we'd be doing ipsilateral, same side, arm and leg. That lifts up the arch more, okay? So it gets the tibialis posterior a little bit more active. All right, now I'm going to get you to do the rocking drill. Ankles flexed, toes tucked under, okay, on all fours, and you're just rocking back and forth, stretching out that big toe. That's it there, okay? Perfect. And I'm going to get you to do 10 of those, okay? Steady rhythmic pace. I'd also make sure she's not wearing mushy shoes, okay? So I would tell her to wear zip shoes, which are like Ziploc bags where I draw lightning bolts with marker on them, basically being barefoot, okay? But minimal footwear to keep those muscles a little bit more active. All right, now I'm going to get you to do pigeon heel raises. I'm going to get you to do 35. It's feet turned in, feet turned in. So you just hold on to the wall here, okay? I'll just move some of this out of the way. There we go. Look at this, I'm even folding it because I just want it to look nicer in here for everybody. Look at this. There you go. And that's how a man folds, okay? All right, and then, so that is going to, now you notice that her ankles aren't collapsing like they did before, because I've got her doing a version of calf raises that are activating tibialis posterior. Now you're going to do these. These are called pigeon foot taps. So these are going to suck, just so you know. But it's a good type of suck, okay? Like hot sauce, kind of like a good suck, right? Like, yeah, exactly. So you're going to have your toes curled under like this. Yeah, that's it. Making a big fake arch, and then you pull your feet up and down. That's it. Okay, good. I want you to do 50 of those. Keep going. Keep going. That's it. Now here's something I can mix in. I want you to have your fists and press them together overhead the whole time.
Why?
I'll explain later. Press those together. Press those together. Okay? Keep these knees locked. Here's why I have her doing this. She's activating upper trapezius to do that shoulder abduction. What does upper trapezius do? It outward rotates that scapula. So I'm throwing in a version of this exercise that works for her. Okay? Keep pressing those fists. Yeah.
Would working the supraspinatus help with
I think the supraspinatus is being thrown along for a ride. If I can get the scapula lined up, supraspinatus will be in more prime anatomical position. So yeah, it would help, but I'm going to try to reposition the scapula first. But yeah, I like the way you're thinking. Now, you okay?
Yeah.
Yeah, what happens if you get someone doing this and the foot cramps are just too much? Like I'm imagining.
Then I get them to punch out the bottom of their feet and go again.
Okay.
Yeah, I just say punch out the bottom of your feet.
It was more like my shins were cramping.
Okay. Just do like maybe a small set of 25. Okay. So back to the pigeon. Yeah, no, we're going to do 2 sets. The last 2. Good. So now she's, just slow it down a little bit, okay? Slow it down. Not a race. Okay, good. So I'm just getting her to do 2 sets. Typically, when I take somebody through it the first time, I want to make sure I'm giving an appropriate dosage. Because sometimes I might do it and things are like a little bit better, like 20% better, and I'm like, well, if we did 2 sets, could we make it a little bit better still? So I'm giving her just a, and then I'm going to get you to do these. You can just do 30 this time, but press your fists together the whole time, okay? Yeah, press the fists together, that's it. Perfect.
Oh my goodness.
Yeah. Don't worry, you need this. First of all, You should be able to do this. You've done crazy gymnastics stuff, and this is getting you. Now, I'm joking because I've trained like pro football players, and stuff like this makes them like cry. Like she's actually handling it like a champ. Like it really does hurt. And then I'll joke about how they play the most brutal sport, and this little rinky-dink exercise gets them, right?
I also haven't trained in like 7 years.
Okay, well, we all make choices. All right, how you feeling?
Tight, sore.
Excellent, right? Let's see how things are,
Okay.
just for the heck of it, okay? Now, let's go here, let's test out your arches. They were a 6 out of 10 each, okay? And by the way, the good thing is being part of a live case study, if things aren't better, we're not done yet. We're just gonna assess more and figure it out, okay? So no pressure on you, and if things are not better, tell me. Don't be afraid to be like, I want to be his friend, so I'm going to tell him it's better. No, just tell me. I want to get to the truth.
Okay.
So do you.
Okay.
So let's just agree to be truthful.
Okay.
So let's test out the pigeon foot. Foot up and in. Inward? Yeah, there you go. Okay, so this was a 6, and we're going to retest it. Resist as hard as you can. And go. Wow. How'd that feel?
Good.
What did you say, 1 to 10?
8.
8. I was thinking about the same. Like it's definitely 20% better, at least, but definitely better than before. Give her a big round of applause. It's gone from a 6 to an 8. Let's test out the other foot. Okay? Resist and go. Same thing. 6 to an 8. Give her a big round of applause. For a couple minutes worth. Now, let's test out your shoulder. Okay? We did stuff primarily for her feet. Okay, I modified a couple shoulder things, but I don't know if that was enough or if I need to give her more shoulder stuff. So that's where it'll get interesting, because now we're all just going to figure this out. Okay, so let's just test out your shoulder. It was a 4 out of 10 with 3.5 out of 10 on pain. Okay, resist as hard as you can, and go.
It's still like with the pain like at the very end, but like the resistance was fine.
So how strong was it, scale of 1 to 10?
Maybe like an 8.
Yeah.
But like
Definitely
the
felt
pain
way
is only
stronger.
like as soon as you stop pushing, that's when I can feel it.
Okay. Yeah, good. Look, well, we can see if we can get rid of that too. But you were gone from a 4 to an 8. And we didn't really do specialized shoulder stuff, did we? No, but it significantly increased a 2-year problem, right? And we can still mess around with this and see if we can make it better. So give her a round of applause. Like, that's a big improvement on it. We're doing foot correctives and her shoulder's getting better. Give me a set of 1-arm downward dogs on that right side. Okay, you know what downward dog is?
Like this?
Yeah. Feet and ankles, just 1 arm on the right arm, yeah.
The bad arm? Yeah.
Yeah. Put a fist behind your back like that. Okay, good. Now go to plank. Go to plank. Okay, good. Now go back up on that arm. Hold for 5. 1, 2, 3, 4, 5. Go back to plank. Now go back up. This is blitzing her serratus anterior. Okay? So you know the spot I was pressing on? I'm blitzing it now. I did some upper traps with her with this. Now I'm doing serratus anterior with this. Okay? And we're just going to see if it helps her pain. We don't know. Right? But she's been suffering for 2 years, so while we all have her here, you guys cool with just messing around and seeing what helps? Right? I know this isn't on the Pigeon protocol sheet, but you can see Pigeon protocol helps significantly for just a few minutes.
How many am I doing?
I don't know. Okay, I think you're fine. Yeah, you can stop. You can stop. Get up here for a second. We're going to loosen up the levator scapula a little bit. It's right in here. It's a little bit of percussion's right here. Yeah, right there. Because that muscle that's really tight can be problematic. Downward go against the shoulder. Okay, we're good. Okay, so let's just see what we get. Who knows? And if it's whatever it is, you just tell me what it is. Resist and go.
No pain.
Big round of applause.